All right, good morning. It is, let's get one more shot. It is January, what is today, 16th? Shot, hold on, shot. There we go. January 16, 2024. And we are doing C6-C7. This patient has a disc herniation, 2, 3, 4, 5, 6, 7. Now, this patient has a herniated disc, C6-C7, left side, severe nerve root and spinal cord compression. He's got a weak arm, numb arm, pain in his neck, and he ended up having the Deuk laser disc repair about, what, 9 months ago? 9 months ago. Yeah. And then he was doing great. He went out and went fishing. And he caught a 100-pound grouper. Pulled it in. He's been having problems with his neck since then. We got another MRI scan. Lo and behold, there's a reherniation at C6-C7. So here we are. It's a big reherniation. Henry, can you see that thing on the MRI view?
Yes, we can.
Yeah. Big reherniation. And the issue with him is he's got a very thick neck. So we're very lucky. Dr. Berndes did an amazing job of relaxing the muscles in the neck. And we got in to 6-7 already. So I'm very happy about that. I've just given some numbing medicine and I'm going to make an incision. Now this surgery, the Deuk laser disc repair, is an endoscopic surgery, and it's done with a 4mm incision, unlike open neck surgery, ACDF, where the surgeon has to make a large 2-inch incision and place a metal plate and a cage. Shot? So that's perfect, guys. So this patient is not going to have metal. He's not going to have a fusion. We're going to fix his disc herniation by going through the disc, leaving it alone, and getting to the back just where the herniation is. This was a technique developed by the South Koreans, Dr. Sang-ho Lee, he was my teacher, and Dr. Gun Choi at the Woodydal Hospital in South Korea. Now, the laser part of the surgery is what I brought to the table. Okay, and what I mean by that, shot, is that the laser is used to remove the herniation. Shot? All right. And it's very precise. Shot, our laser is 0.5 millimeter wide, and it has a precision of 1/10 millimeter. Shot? All right, so I'm just taking lots of x-ray pictures as I advance my dilator. Shot? The dilator is sliding down the guide wire. The guide wire, you can see it there, is right in the disc. And now the dilator tip is just about, shot? There we go. Wow. And he has a very big chest, by the way, very big chest. You can see his chest is humongous. He's a big guy. So we're very lucky to have gotten here this far. And honestly, couldn't do it without the right anesthesia. Being totally relaxed. We use muscle relaxers, we use general endotracheal anesthesia. Let's get an AP, see where we are. We want to verify the tip of the dilator is in the middle of the spine. Remember, we're in the front of the spine. Perfect. So you can see the tip of the dilator. Jordan, show the audience the tip of the dilator. It's right there, almost dead center, just about 3 millimeters off to the center. I like that. Keep going. Let's go back to a lateral view. At this point, we're going to advance the dilator down through the disc to the back where the herniation is. Jordan, show us where the herniation is on that lateral view. That's correct, right there. It's literally pushing on the spinal cord and the nerve. At this point, we're ready to advance our dilator through the annulus. Remember, the dilator is tapered. The tip of it is pointy like a pencil. So it doesn't cut anything. It actually just spreads tissues apart. Perfect, guys. Just keep it right there. You guys are doing awesome. Shot? All right, now we're at the back of the disc. I'm in the herniation right now. Take a picture. See the tip of the dilator? Show us the tip. We're right in the annular tear where the herniation came out of. So I'm right at the base of this herniation. We don't actually need too much inline, but let's see. We're almost done. This is going far better than I hoped it would or expected it to. This patient has a thick neck like a football player. Now his lovely wife is here with his daughter, and again, they had this same surgery done 9 months ago. So he re-herniated. 1% of our patients re-herniate, 1 in 100. It's probably around 1.1, just slightly above 1. But re-herniations happen. That's perfect on the x-ray. Hold on. I don't need that. Nope. Let's just advance it. Re-herniation is when the patient spits out another herniation. And typically they'll tell me what they did, what they shouldn't have done to make that happen. In his case, he literally brought in a 100-pound grouper on a pole. And he told me he didn't expect to catch a grouper. So, but I thought that's kind of funny anyway. If you catch a 100-pound fish and you just had neck surgery, let the fish go or give it to somebody else to bring in. Right, Henry?
Indeed so.
Yeah, but certainly don't re-herniate your disc. That's a bad idea. Okay. Pretty happy with that. We're right at the back of the disc, right where the herniation is.
Yes, yeah.
The herniation is off to the left side. Look at the size of the shoulder. This is humongous, like incredible. Again, we're very lucky to have gotten in. I told the patient there's a 5% chance we won't make it into the disc. We'll have to abort the surgery because his neck is so thick. We're doing C6-C7. But fortunately we got in. Everything went well. The stars are aligned. Let's see this herniation. Remember, he had the DLDR 9 months ago. He re-herniated, bringing in a 100-pound fish. He's also been doing some other things. And just for reference, you see that glass fiber right there under the blue? That blue is plastic. The glass fiber of the laser is 1/2 millimeter, 0.5 millimeter. Folks, a millimeter is already very tiny. 1/2 millimeter is half of that. So you can imagine how small, how magnified the view is and how small these structures are that we're operating. Now it turns out the laser, I'm able to control it to 0.1 millimeter. 0.1 millimeter. So already we are in the herniation. This is all herniated disc right here. So we're in the herniation, and again, the laser is extremely precise. It's more precise than any surgical instrument. I hear people talking about, well, Dr. Deuk, isn't the laser dangerous? Any tool used in spine surgery is potentially dangerous. Yeah, every tool. The laser is the least dangerous of all. The laser is the least dangerous of all because it's the most accurate and most precise. Other tools are far bigger and far less precise. But because the laser is so a precision of 0.1 millimeter, that's 10% of a millimeter. The reason why we're able to use it so precisely is because we have the endoscope. This is the herniation right here. Look at it. It's humongous. That's all herniation. It's too big to take out of the tube. Remember, the tube is 2.8 millimeters diameter, one side to the other. So I've got to break it up into pieces to get it out. Now, remember, sometimes herniations are already in pieces. Most herniations are already in multiple pieces. So it's just a matter of fishing them out. It turns out because the annular tear is typically around 4 or 5 millimeters that the herniations are also close to the same size in the cervical spine. In the lumbar spine, they're generally bigger. How's he doing, Dr. Berndes? All right, thank you. Henry, let's show the audience. God damn it. Sorry, that was my foot. Let's show the audience, why do herniated discs cause neck pain? Because that's a problem a lot of people have. Here's the herniation. In the meantime, I'm going to work on it. I think we're a little bit overexposed, guys.
Yeah, okay.
Maybe just take it down one click. Welcome back. Again, we're on the C6-7 disc, which is where the herniation is, the big one. And we are slowly working at getting rid of this herniation. The problem is the herniation right here, you can see part of it there, is in multiple fragments, and it's going to take some time to get it out. It's a pretty good size herniation. This is all herniation right there. We have some questions, Henry. Let's take those questions while I'm working on this.
Yes, this question comes from Dickerson Audio Designs on YouTube.
Uh-huh.
And they said, I have a 5mm herniated disc at my C5-C6, supposed to get shots tomorrow, but I have doubts and worried of risks. My doctor is Zhonggang Zheng and is recommended to do these shots. Should I get a second opinion? Also, I'm 20 years into my career at UPS as a package driver, so I'm not sure how long I can continue with my work with the pain I'm having. Should I consider this surgery instead?
Yeah, great question. So, thanks for asking. The reality is shots don't fix the problem, ever. We've never seen a shot give a permanent relief. And the doctors will tell you that. They'll tell you the shot's temporary. The shot does have some value in that if you get a shot, you can actually see if it helps, and sometimes that gives the doctor good information, right? Because typically an epidural shot, for example, is going to help pain from a disc herniation, basically inflammatory pain. So the way I like to think about shots is this. Let's pretend you're a teacher and summer break's coming up in 2 months and you got to finish teaching your class, right? You don't want to leave. You don't want to take time off work. So what you do is you get a shot, and the shot gives you 2 months of relief while you finish teaching the class. At the end, you go and you get your surgery done in the summer when the students are on summer break. So you can use the shot strategically to basically buy you time before you get surgery. Are shots safe? For the most part, they're safe, but every surgery, every surgical procedure, every shot has risk. There's always a risk of complications, okay? Every surgery can have complications. Every shot can have complications. Shoot, even taking pills have complications, right? As a matter of fact, even going to the chiropractor can have complications. There are people who, you know, the chiropractor causes an injury to their spine. And they get paralyzed. I've seen it happen. So there's not a single thing in life that doesn't have no risk, you know? So you got to weigh the risk and the benefit of each treatment. And when it comes to shots, I think they have value in that they can help you postpone surgery for a little while. But in the end, you're going to need the surgery done. And this is the best surgery for a herniated disc that's causing neck pain, especially a small one, which it sounds like you've got a smaller one. Dr. B, I think 10 more minutes. Yeah. So, anyway, for what it's worth, this is a bone spur right here. We're taking it out. And that bone spur is basically locking in the herniation. You guys see the herniation? The herniation is literally right there. That's the bulk of it, right here. And it's stuck in the foramen. And now I'm removing bone spurs. And the problem is his chest is actually blocking me from getting the perfect trajectory, which it would do no matter what surgery we did. If we did a fusion, the chest would be in the way, okay? And that's what surgeons have to deal with, is that some patients' anatomy makes it extremely hard to do the surgery, as this patient's anatomy is doing. There's another piece of herniation, pretty good size one. Look how white it is. All right, Henry, show the audience how this particular surgery works. What are we doing here? Give them an idea. Oh, welcome back. We're still working on this patient's disc, C6-C7, and I'm off to his left side, which is where the herniation is. I'm taking down some bone spurs right here in the foramen, and his herniation is what we call foraminal. This is the uncovertebral joint, and you can kind of see a piece of herniation medially, but this is where the big part of the herniation is pressing on the nerve, right in here. And I see some scar tissue, but that's the herniation right there. I've got to figure out how far lateral I can get safely, of course. See, this is the nerve root right here. And I'm going to come medial and get this piece of herniation out. Sorry, Brenda, it's taking a little bit longer. But yeah, see how it rolled out of the way there? It's interesting. Now I'm looking off to his right, but I'm chasing the herniation off to the right. All right, this is all, that's spinal cord. Now there is some ligament there. Probably going to have to take that ligament down because the herniation may be trapped behind this ligament. So I'm going to do it very carefully. because we're sitting literally next to the spinal cord. That's what we call the posterior ligament, posterior longitudinal ligament. And by the way, this is an incredible video right here, because you see the spinal cord down there, the white thing? I'm literally peeling off the posterior ligament fiber, one fiber at a time. And you don't get to do this with an ACDF. You cannot see this. It's impossible. Now, the reason I'm doing this is because I think part of the herniation's behind the ligament. And it's hiding right up against the spinal cord. And let's see. Look at all that inflammation there. The red. Okay? Yep, I was right. It's here. You see how it's stuck between the fibers right there? That's herniation. That's fiber. This is all herniation as well. Uh-huh. Luis, help me watch the tube.
Yes, sir.
Look at that right there. Yeah. We're literally sitting on top of the spinal cord. So we got to be really careful, really, really careful. Look how red and angry the spinal cord is. That's called the dura, D-U-R-A. It's the covering of the spinal cord. This is part of the herniation right here. Okay? This part was not deep to the PLL, posterior ligament. This was superficial to it, but it's part of the herniation. It needs to come out. You see how we float these fragments out with the tube? So the laser basically frees them up. That is the spinal cord. Okay? And I'm trying to get all this stuff off the spinal cord. Keep an eye on the tube.
Yes, sir. Pushing towards, right? You're saying?
It's his disc is so big. He's a big guy that the whole system there is part of the herniation. There's part of the herniation. Big, big, big herniation. And man, that thing's big. It's just not wanting to come out of the tube so easily. So I'm going to break it down into little pieces, kind of like a FedEx delivery, little packages rather than a big one. It's easier to manage, right? That's for our FedEx driver who's watching. Any other questions?
Yes, we have a couple more questions. This next one comes from Matthew on YouTube.
Hi, Matthew.
And they ask, is this a procedure that most insurances cover? I have been suffering with a C4-5 bulge for over 15 years and have been fearful of other invasive surgeries.
Yeah. Great question. Do most insurances cover it? The answer is they should, but like all insurances, they give us a hard time a lot of times, and we have to fight them to get them to pay. And so it could take a long time, a lot of fighting to get insurance to pay. But there are many insurances that have covered it. We've had over 100 insurance coverage payments for the procedure in the last couple of years, but many times they'll deny it too. So the problem is that the insurance companies don't like new technology, because to be quite honest with you, it's far better sometimes than what's already being done. And the insurance companies know that patients are going to want to do it. So they don't want to pay. That's really what it comes down to. Look at that thing. Big, big herniation. It's the same herniation I've been working on. There we go. There's another piece. You see that? How I kind of cut it and take it out piece by piece. We call that piecemeal. Can't get it. I'm gonna have to chop it down a little more. It just disappeared. Look at that. Incredible. Slippery little herniations.
We have another question.
Yeah. So to answer your question, the way we handle insurance, we bill the insurances except for Medicare. Medicare won't pay. And then we will, first of all, we'll have to take a deposit from the patient, right? So the patients will pay a percentage, out of pocket, whatever it is. I don't know those numbers, but it's different depending on how much surgery you're getting done. So we take a deposit, we bill your insurance. If your insurance pays the whole bill, then you can get your deposit back, but they got to pay the full bill amount. So we do take a deposit up front, and that's an out-of-pocket, and you have to do that anyway, you know, wherever you go. So, but when you ask, will the insurance cover it, I don't know. I'll be honest with you. They should cover it. Doesn't mean they will. All right, let me see here what we've got. Jordan, you got that MRI up? This has taken a little longer than I expected because the herniation is scarred down. This is just, I got to have you help me here. Okay, this is getting trapped and it's not allowing me to move. Here we go. There's a big piece of herniation right out of the foramen. Nice. I have to chop it down into little bits. Oh, interesting. These herniations are quite interesting. All right, Henry, other questions for me?
This next one comes from Jenny on YouTube.
Jenny?
Jenny.
All right.
They ask, how come putting the laser through the disc to get through the herniation does not cause more damage or herniation to the entry side?
That's a great question, and it has everything to do with the tools we're using, as well as, hold this here, as well as the fact that the disc is pretty much gelatinous, you know, in the center. It's very jelly-like. So it doesn't have really anything that you can damage. It's kind of like Jell-O. Think about Jell-O, right? With Jell-O, you can push something through it and then take that something out, like a pencil or something. And you don't have a problem. So, all right, it looks like most of the herniation's gone. We still have some stragglers here that are bouncing around. He has a very unusual disc back here. And what I mean by that, it's very scarred. And it doesn't want to come out. It's like hiding around the corner. Every time I trap it and I isolate it to get it out, it just disappears. There's a little piece there. So I've had to take it out in several pieces. And you can see the spinal cord. I'm not quite done yet, so don't get excited. I'm going to try to grab that. Every time I go in to grab these pieces, they kind of elude my grabber. There's a piece. And each of these pieces, they look big, but they're not. They're only a few millimeters. So they may look big to you, and me, because of the endoscope, is magnifying the view. But the reality is they're small. They're all small, but when you add them up, they make a big herniation. Keep the questions coming. I'm happy to answer them. There's a bone spur.
This next question comes from Dickerson Audio Designs, once more on YouTube.
Yep.
Saying, thank you. That's been the most difficult part. I have vacations, but no extended downtime. How long before I could return to work after this type of surgery?
Well, if you're a UPS delivery person, I mean, you're lifting boxes. So we don't want you lifting heavy boxes. Remember, this patient right here had the Deuk laser disc repair 9 months ago. He did fantastic until he went fishing and took a 100-pound grouper out of the water, right? He fought a grouper, a 100-pound grouper. Well, and after that, he started having problems, okay? So, long story short, you don't want to overdo it. You want to give your disc time to heal. You can go back to your job, but you cannot be lifting anything over, say, 40 pounds maximum for the first year. That's our restriction, it's 40 pounds. All right, it looks like there's still a piece of herniation here. See it? Now I got to figure out how to get it out. It's right on top of the spinal cord again. Just a few fibers of the PLL there. And the reason I mentioned that the spinal cord is red, it's inflamed. A lot of people don't understand just how the disc herniation, it's actually an inflammatory disease. It's also a compressive disease, but it's an inflammatory condition. Look at that herniation right there. You guys see it? It's literally sitting on top of the spinal cord right there.
Yes, we do.
I'm going to try to grab it. Damn, this guy made this case really hard for me. This is as hard as it gets. I don't think I got it. Did I maybe? No? I do enjoy a challenge, but this is very challenging. Look at that thing. That's a big herniation right there. I'm going to have to break it down into pieces. It's right there. If I could just grab that. Take this and... So... I think I got it. Oh, we got it. Look at this, Henry. Oh, yeah. Bring me that thing. I need a few more minutes. I need to go back and look. I mean, come on, guys. Where's the ruler? Fucking hell, Bruce. Anyway, can you see this, Henry?
Yes. Yes, we can.
That's about 7 millimeters. All right. Who set the room up? No, don't open it. Just forget about it. It's just not worth it. This is just not my day. How's our guy doing? All right, that looks really good. How's our other guy doing? Yeah, we're almost done. I mean, literally 5 minutes max. I just want to make sure I got everything. All right, almost done. That, folks, that is the spinal cord right there. Henry, you see that?
Yes, we do.
Spinal cord, okay? That thing was crushing the spinal cord, that herniation we just took out. And I don't see anything else here, okay? But I got to look one more time, you know, just to be sure. By the way, that's the spinal cord, and that's the side of the spinal cord right there, and that's the nerve root going in the foramen. That nerve root, since this is C6-C7, that would be the C7 nerve root on his left. There's still a little bit here, right here. I just got to get this last bit, and then we're good. Okay. I sure hope he takes care of himself and doesn't come back again. I told him the next time he's going to have a fusion done. He comes back again. We've had 1% of our patients have reherniation. And I said it's about 1.1 actually. So 1 out of 100 will reherniate. And when they do, I can usually just do a laser again and get it out, fix them. But some people don't want to do the laser a second time, they just want a fusion. I'd say 1 minute. 1 minute. Do you hear me, Bernadette? All right, bone spur's gone. I don't see any more. Again, we're dancing right on top of the spinal cord there. That is the spinal cord. The reason it's red, we pull that herniation out right from there. Turn. And herniations are inflammatory. They cause bad inflammation. Let me just take one more peek here, just to be 100% sure. This again is the PLL, posterior longitudinal ligament, and I'm taking it down. I don't normally have to take it down in most of my cases because the herniation is not in the epidural space. It's called a subligamentous herniation, meaning it's It's on the disc side. See, I don't see any more herniation there. It looks really, really good. I think we're done. Let me just verify one more time. I don't want to have to come back. That's definitely not herniation. That's the nerve. I don't see herniation there. Let me just see. I want to make 100% sure. Sorry, Berndes. I just need another minute here. I don't think I'm going to uncover anything in the foramen here, but I'm literally peeling a tenth of a millimeter at a time, the foraminal ligament. I don't see anything. That's all nerve root right there. That's a great view of the nerve root and the spinal cord, Henry. Spinal cord going off to the nerve root. We're done. Okay. Tough one. All right, any questions, type them up. I'll answer them for you. But you could see the dura, it's supposed to be white, and it wasn't white because the herniation was causing inflammation. Oh, by the way, that inflammation is what the epidural steroid injections do. That's what they attack. They attack the inflammation around the dura and the nerve root.
I have everything? Yeah, thank you.
Okay, we're done. Take. The next patient has, I think, a little easier neck for all of us. Well, our stress level will be a little bit lower. He has a long, thin neck, and he's 5'6", so it shouldn't be too difficult. He is from Texas? Yeah, I think Texas, Dallas, Texas. So this patient is from? Delaware. So we just finished a patient from Delaware. We're here in Florida, by the way, and the next patient is from Dallas, Texas. And just to bring back our big herniation, the big giant one, so you guys can see it, here. Can you see this, Henry? That thing's huge. That is actually about 8 millimeters. And that's the big one that was sitting right on top of the dura. Can you see that?
Yes, we can.
So, and then there's a bunch of little pieces everywhere too that we broke up. So I'm happy with the results. We dodged a bullet there. And you guys can see his incision, probably 5 millimeters. Little pieces of herniation laying around everywhere. We're going to put a little steri strip and a Band-Aid. All right, type your questions up. I'll come answer them for you after I check the next patient out. Henry, go ahead and show them one of our patients that had the surgery. And good morning, I'm Dr. R. Deuk, CEO and founder of the Deuk Spine Institute. I'm here with one of my patients who's traveled far to come to Deuk Spine Institute, all the way from Michigan. What brought you from Michigan to Florida?
I was scheduled for fusion to have just my one disc, C5-C6 fused. I'd had disc herniation before in my lower back, had it done. I didn't want to have to go through that again, so I did some research. Found you had a good record. Your history is impeccable, so I decided to come down here and have it done.
Well, you didn't have a fusion though. You had something else done.
Yeah, I'm sorry. So instead of fusion, instead of going through and the complications and risk of fusion, lack of mobility, I wanted to have laser. I talked to somebody in Mexico that had laser surgery, and she said it worked great. So I thought I'd pursue that avenue, and that's when I kept Googling and searching and trying to find the right place. Some places had bad references. You had impeccable record, so this is why I came here, and I'm glad I did.
Yeah, so you were recommended for fusion by another doctor, and let's talk about that for a moment. They were going to fuse one disc, right? Number 5-6?
Correct.
Now, if you go to your surgery video here, you could see that we made a tiny 1/4 inch, 4 millimeter incision. And we fixed 2 discs, not 1, but 2. And it turned out that the disc that you were not going to have fused was actually the worst one. It was the one that was causing the vast majority of your symptoms. And the reason I'm talking about this is it's a common problem. It comes down to being misdiagnosed. And misdiagnosis happens all the time, all over the world with spine problems. And that's what we're trying to fix, is not having patients get the wrong diagnosis, because the wrong diagnosis will lead to the wrong treatment, because treatments are always based on diagnosis. So if your diagnosis is C5-6 disc, the treatment will be fusion of the C5-6, but that's wrong because you had 2 discs that were problematic. We fixed both. You can see in that video, we were taking out lots of little chunks of herniation out of your C6-7 disc. Definitely needed to be done. How do you feel today?
I feel great.
Yeah, do you still have the same neck pain you had when you came here?
No, my wife can already tell that my shoulders are relaxed. My neck, I feel great. Feel very comfortable.
And you had your surgery just 24 hours ago.
Yesterday morning.
Yep, and you can see you have a tiny 4mm incision with a Band-Aid. No metal, no fusion, no narcotic painkillers after surgery. We didn't give you opioids, so that's another plus to the Deuk laser disc repair.
I agree.
Yeah, you don't need to be on powerful painkillers. You're back on your feet already, walking around, not in the hospital.
Yep, great. I'm glad I had a guardian angel looking after me.
You did have a guardian angel, and you're welcome. We enjoy helping people like you have successful spine surgeries. Is there anything else you want to tell your fans out there?
Basically, if you need the surgery, if you're having complications, neck, back, definitely come here. I don't care what it costs you for travel or whatever. You can't, it's worth, priceless.
I agree with you. It is priceless to get out of pain and have no complications from your surgery, and nothing bad that hurts you or harms you or changes your life in a negative way. So congratulations. And when do you guys head back to Michigan?
Saturday.
Saturday. So you're going to spend a few more days here?
Yes, sir.
What are you going to do for the next couple of days?
Well, we plan on hanging out in the sun, but
yeah,
it's not the case right now.
I think, yeah, well, you could do. Oh, yeah, it's just a little overcast right now. Yeah. But this would be a good day for you to go check out the Kennedy Space Center. It's about 10 minutes away. They have all the displays and history of NASA, and it's really worth visiting.
I'll do that.
Save the beach for tomorrow.
There you go.
Sunny day.
All right.
All right, congratulations. You're welcome.
Thanks again.
Dr. Deuk Majan, CEO and founder of Deuk Spine Institute, Deuk Joint Institute. I'm here with our patient from
Louisiana.
That's right. I had to have him say it. He sounds better when he says it. Why did you come all the way to Florida to the Deuk Spine Institute?
Well, about 3 months ago, I was scheduled for a cervical disc fusion in Shreveport, Louisiana. Had done all the pre-op stuff, was scheduled within 2 weeks to do the surgery, got to work and started doing some research. The more I read about what they were going to do with the fusion, people having trouble with it down the road, above and below the fusion, decided there had to be a better option. So that's when I found Dr. Deuk and his team and started watching some of his videos. Pretty impressive.
And you're a YouTube guy, you were
Yes,
telling
sir.
me, so you found us on YouTube, and what did you think?
Well, our first impression was any doctor that will put his livelihood live on YouTube, showing all of his surgeries, putting it out there, believes in what he's doing. That's not many doctors would do that.
Not just because of that, but because, afraid of complications, which, praise God, we haven't had a complication. We've been doing it now for 17 years. I want people to know there's a safer, better way to take care of their problem other than metal, fusion, stimulators. That's really the message there. You got that message loud and clear.
I did. My surgery was less than 24 hours ago. So far, the tingling, numbing going down my arm is non-existent. It's went away where it was there constantly all the time before. So hopefully this continues on.
Oh, it's gonna continue on. Our results are permanent with the laser surgery. And you can see your tiny little incision right there. It's a 4mm. You can see we went in with a little tube into your disc. I was able to get both discs fixed. You had a lot of herniations in there. Something a lot of people don't understand. They think that a herniation is one piece, but it's about 30 pieces on average. And you had about 30 pieces in each of your discs. They were hard to get to, but we got it done. And I was very happy with the end results. We got all the pressure off the nerves, and we fixed the tear in the back of the disc. Less than 24 hours, here you are. You're doing fantastic. Now, what did your wife think about you coming down here to Florida? Was she supportive?
She was. This problem had been going on for many years. Started out on my right side years ago and had some stuff fixing that, but she knew the problem I was having. I'm very active. I'm a scuba diver, a motocross racer, do a lot of active sports, and she said, we've got to get this fixed. I'm too active still to actually quit all this. I don't want to quit, so this fusion just seemed like it was going to limit my options on doing things. So that's why we come down here. She was very supportive, and we decided to sign up and come on down.
What do you have to say to your insurance company? What do you want them to do?
I sure hope they pay, because I know they would have paid on the fusion deal, but why they would not pay on this, I don't know why, because results are immediate.
And no narcotics.
No, haven't taken a pain pill, haven't taken anything, nothing. Slept like a baby last night.
That's right. And after fusions, a lot of patients end up in pain management. They're getting shots, they're getting pills.
They can't talk, their esophagus is all tore up from them pushing it out of the way.
That's right.
And I have none of that.
Yeah, our patients don't go to pain management because they don't need it. Anything else you want to say to your fans out there?
If you are considering having some type of neck or back surgery, I think you ought to look at Dr. Deuk and his group, because they got a great facility down here, very accommodating. They'll help you with travel, whatever you need. We flew down Sunday. Today's Wednesday, and we're going to stay till Sunday. Enjoy a little bit of Space Coast. Hopefully get to see a rocket launch here on Friday morning.
That's right. You can see the rocket launches from here and feel them. All right, sir. It's a pleasure.
Thank you, sir.
My pleasure. You have a great day.
Okay.
Let's get you guys out of here. You got better things to do than to sit in a doctor's
Exactly.
office. And, well, what a testimonial from one of our patients who had the Deuk laser disc repair. So this was a tough case for several reasons. One, the patient has a very thick neck, short neck, collarbone is high, so it makes getting down to C6-C7, which is the disc herniation, very difficult. Yes? Yes. So he basically had a thick neck, short neck, made it very difficult, but we gave him really good, and he responded to the muscle relaxer, which makes getting to the spine from the front, past all the muscles here, makes it accessible. So we were able to get down to 6-7 quite easily at the beginning of the case, and the rest you saw. We were able to get the discogram done, and then we put the tube down, and we were basically getting all the herniation off the spinal cord and the nerve root. Now, herniation was off to the left side. It was humongous. We had to break it down into little pieces because it couldn't all come out of the tube. Now, when you get a herniation, a lot of times you're going to have between 5 and 25 pieces of herniation. In his case, there was really mainly one big one and a couple of small ones. And we had to chop the big one up with the laser into pieces, and it worked fine. But at the end, you could clearly see the spinal cord. You could see the red veins and capillaries on the spinal cord. They were upset because that herniation was sitting on the dura, causing inflammation. Inflammation is redness, swelling, pain, and tenderness. So that's what was causing his discomfort. But more importantly, his spinal cord was being crushed. The nerve was being crushed in the foramen. We got out a couple of small bone spurs at the same time, but mostly we removed the herniated disc. At the end, you can see there was nothing pushing on the spinal cord. I was very happy with that. All right, let's take questions.
This first one comes from Bora Bora on YouTube, and they ask, is the herniation stuck in the PLL?
Yes, great question. Was the herniation stuck in the PLL? The answer is yes. If you look here at the spine, here's the front of the spine, here's the back of the spine. That's the disc that we're operating on. If you look in through the spinal canal, you can see this thing right here, this gray or beige-like band that runs down the back of the disc, okay? There's the front of the disc, there's the back. That is the posterior ligament, and it sits behind the disc, between the disc and the spinal cord, really. And so this patient burst the herniation out the back of the disc, the annulus, but also through the PLL. So you could see as I was using the laser, I was removing literally one layer of PLL at a time. That is, there's no other surgery in the world that lets you have that much precision and detail. So it's the most precise surgery in the world. You're operating on top of the spinal cord and the nerves. You want to be as precise as possible. So you could actually see so well that we were cutting literally fibers of the PLL off. They were popping up, and we were taking the herniation out from inside and underneath the PLL.
Next question comes from Jenny, once more on YouTube, asking, do desiccated disc herniate? And if so, you go through them to operate? Just curious.
Yeah, that's right, Jenny. Desiccated discs are also herniated discs. As a matter of fact, the only way to get to a desiccated disc is by having a herniation. Desiccated disc is a disc that herniated a long time ago and dried out. So there's always a herniation, there's always an annular tear, even with a desiccated disc. Yes, this treatment can be used to go through the desiccated disc, get to the back where the annular tear and herniation are, and to remove them. Not a problem. We do it all the time. The surgery you're watching, folks, is the surgery that will replace anterior cervical discectomy and fusion, anterior cervical arthroplasty, total discs, artificial discs, cages, plates, anything that gets stuck in your spine and the neck. This surgery is the best surgery in the world for it, and it will eventually replace all of the metal and fusion and artificial disc surgeries. The problem is that those surgeries, unfortunately, pay a lot of money to the surgeon, the hospital, the company that manufactures and distributes those metal implants. So they're making billions of dollars a year in profits. They don't want those surgeries to go away, because the surgery you just watched, we don't use a hospital, we don't use metal implants or cages. So those billion-dollar companies are going to go out of business, basically, if all the surgeons started doing what we're doing. And of course, you don't get paid as well as a surgeon. I made 10 times more money doing fusions than I did doing laser surgery. So you have the surgeons who are recommending you surgery. They're recommending the metal, the fusions, the artificial disc, because they make more money. You have the hospitals wanting those invasive surgeries because they make more money. You have the implant companies wanting those surgeries because they make more money. So really the only person that stands to benefit from this type of surgery is the patient. And you guys are being marginalized or sidelined. Your priorities, your importance, unfortunately, which is why we have our channel, to get the message out so you guys can find out the truth.
Last but not least, from Janet on Facebook, asking, why would someone want a fusion?
It's not, Janet, it's not that people want fusion, it's that they're not given the choice. Their surgeon won't tell them about this laser surgery because A, the surgeons make a lot more money doing fusions, B, the surgeons have never been trained on this. I had to go to Korea to learn how to do endoscopic anterior cervical surgery, and I brought that technology back to the United States. I'm the only surgeon in the United States doing it. So it's a problem. Patients don't want fusion. They want this. However, they don't know about it because their surgeons won't tell them about it. And when the surgeons do tell them about it, they lie to the patients and say things like, the laser's dangerous. You don't want a laser around your spinal cord. I mean, it's complete nonsense, you know? But that's why we do what we do. We're here to spread the message, the truth. We want people to know the truth. I think that people should know the truth. This is your spine, after all. You have to live with that metal plate the rest of your life. You know, I've put 1,000 metal plates in my patients over the years. I stopped doing this surgery because the laser is so much better for the patients. That's why I stopped. Unfortunately, most surgeons will not stop. They will continue to do it because it's basically an inbred system where there's rewards, big rewards for surgeons, implant companies, and hospitals for doing fusions and recommending them. So that's why we spread the word.
And that is it.
All right, we're going to be done, and we're going to end the broadcast. We have another anterior cervical Deuk laser disc repair. This next patient's from Texas. He's here with his lovely wife, and he has one disc that needs to be fixed. So we'll be doing that next. Hopefully you can join us. And our last surgery is a lumbar, right?
3-level lumbar. Yep.
3-level lumbar Deuk laser disc repair. Patient has 3 herniated discs, degenerated discs, having back pain. We're going to go in there